Well, today on the show, we're back out at Gulfport Behavioral Health System on Highway 49 in Gulfport. We've been here many times telling you all about the wonderful things they do have to offer if you're in need of them. And first off, we're talking to Dr. Brian Gaddy, who is the medical director here. How are you, sir? It's good to see you again.
I'm doing well. Thank you very much. It's good to see you.
Give us a little bit about your role here at Gulfport Behavioral.
Okay, my role is the medical director, so I lead the medical team, the medical staff here. Primarily, I see patients that come in. I evaluate patients in both the outpatient clinic and the inpatient setting, and I come up with treatment plans for each patient that comes through, and I lead the medical staff.
And of course, with each and every one of them, there is some things after they have treatment here that you continue to follow up with them.
Yes, we try to provide the best possible care in the region, so we are available for intake assessments 24/7. And so when someone comes in for an intake assessment, generally that's when we would make a decision as to whether they would go inpatient or outpatient. And then, so we provide that full spectrum of care from even an emergency kind of crisis situation to the aftercare as well. And so, you know, like I said, we just want to provide the best care possible in the region.
Well, we're going to kind of take you through the process of what they do here at Gulfport Behavioral today. Now, Lacey Hurd is the nurse on unit. How are you doing, Lacey?
I'm doing well. Thank
Good.
you.
Tell us a little bit about what your daily routine is here and what you do.
So here at Gulfport Behavioral Health, we provide quality patient care to our patients, medication management, group therapies, and overall just one-on-one care to our patients that are here. Mm-hmm.
Now, of course, as you mentioned, every patient interaction really matters.
Right.
And as you said, one-on-one makes a really big difference for them.
It does. It does. Our patients here are here because they need a little extra help to get them back on the right path so that they can be productive members of society. So every interaction, big or small,
makes a difference.
It does. It makes a huge impact on our patients here.
Howard Fortenberry is the psych tech here at Gulfport Behavioral. How are you, sir?
All right. How you doing?
Very good. Good. Tell us exactly a little bit about yourself and how long you've been doing what you do and what you do.
Okay. I'm a mental health tech here at Gulfport Behavioral Health System, and been working here for about a little over 17 and a half years.
Wow.
So my role here is to direct the patients where they need to go. That's one thing I do. We have different activities that they have to go to, therapeutic recreation and process groups that they go to, and I make sure they get there when they're supposed to get there. Make sure they get there on time and safely also.
And you also work training other employees.
I do. I am one of the instructors here. I help out with training when certain patients have I'd say special needs or crisis situations that we have to deal with, and I help keep everybody calm and relaxed in those situations, as well as staff and the patients.
Well, you have a very calming demeanor about you, so I feel like you're perfect for what you do.
Yes, I try to stay calm as calm as I can. Yeah.
You can always play with one of the dogs.
There you go.
There you go. All right, thank you, Howard. Appreciate you very much.
No problem.
You know, you talk a lot about the care that the patients get here at Gulfport Behavioral, but there's also the families of the patients that need some support as well.
Absolutely.
And this is where Charlotte Terrell comes in. How are you?
Absolutely.
Good to see
I'm
you
well,
again.
thank you. Nice to see you.
Tell us a little bit about your role here at Gulfport Behavioral and you're dealing with the families.
We bring it all together and we try to make sure that the families have the resources to make sure that once the patients are discharged, they have the success to be able to take the next steps, whether it be an outpatient provider, or I've even connected some families with mentors for some of the young men. So just making sure that everybody is on the same page and they're getting the things that they need.
Talk about next steps. The traditional outpatient, partial, and the intensive outpatient work that you do with them.
For the next steps, again, we connect them with the community resources.
Right.
So that could be a therapist, it could be long-term residential facility. It can also be outpatient here at the hospital, where we provide outpatient services for the teens and the adults.
So the families of your patients are not forgotten.
No,
because
absolutely
it's very
not.
important that they're
No,
closely involved.
as a matter of fact, I also recommend sometimes that the families go to therapy, and I give them an outpatient provider that will provide them with those types of services so that they can meet those needs as well. So once the patient comes home, everybody is in a cohesive manner and they're functioning together, and it's a healthy lifestyle and a balance.
Thank you so much.
Thank
it's good
you.
to see you again.
All right, thanks.
And now we're talking to Tara Walker, who's Director of Clinical Services. How are you?
I'm wonderful. How are you?
I'm doing well. Tell me first a little bit about yourself.
Okay.
And how long you've been working here.
I have been at Gulfport Behavioral Health almost 2 years. And I am a licensed master's level social worker, and I'm the Director of Clinical Services. So in that role, I cover the inpatient services, outpatient services, and recreational therapy.
Wow.
Yes.
That keeps you busy.
All day long.
So do you schedule whenever they get to play with Doc?
Well, sometimes I kind of walk in there because it kind of helps me too to kind of relax, to have some pet therapy and to.
Oh, pet therapy is the best in
you
the
know,
world.
kind of it's good relaxation.
What are some of the other things that you do, if you would, Tara?
Okay, well, one of the things that I do, I make sure that the groups, I look at the programming and making sure that the patients that we serve get the care that they need. Making sure that they're therapeutic, whether it be community groups, psychoeducational, therapy groups. I just kind of make sure that
because each one is going to be different.
Yes.
Every patient is going to be different to work
Yes,
with.
yes.
And you want to be sure that they, excuse me, get the proper care or attention or whatever or service
Yes.
that they need.
Yeah, we kind of do the programming based off individual needs and services.
The important thing is with the services that they go through here, that whenever they do leave here, they're able to live the fullest lives that's possible with themselves, and that's what you help set up
Yes.
do.
The continuum of care is very important because we see that if a patient has a gap in services, that's when they tend to be most vulnerable. So the goal is to make sure that when they come for services, not only are they getting inpatient services, they're also getting outpatient services if they need it. And in our outpatient program, if it's okay if I can talk a little bit about that.
Sure, you got about 20 seconds.
Okay, we provide services to adult patients, military and veterans, and we also have an adolescent program also in the evening from 5 p.m. to 8 p.m.
That's awesome. Tara, thank you so much for
Thank
your help.
you.
If you feel like you need the services of Gulfport Behavioral Health System, the number's on your screen. Give them a call and come and visit them.